My name is Micah Jones. I'm an orthopedic surgeon at LewisGale Hospital. I subspecialize in adult hand and upper extremity, as well as I do all the pediatric hand and upper extremity for the hospital and the surrounding areas. Carpal tunnel is a diagnosis where normally a patient will have numbness, burning, tingling, or achiness in their palm or their hand, particularly on these three fingers. Carpal tunnel can be caused by multiple medical problems such as diabetes, hypothyroidism, or even pregnancy. The reason for that is the lining of the tendons that bend the fingers, those all go through the carpal tunnel. And so when those linings get thickened or inflamed, those can put pressure on the carpal tunnel nerve. Other things that put pressure on the nerve are positions we sleep in, and we tend to sleep with our hands folded like this, or we tend to do repetitive things throughout the day like typing, etc. And those things put pressure on the nerve, which then causes the nerve to get inflamed and irritated. So 90% of the structures in the carpal tunnel are the tendons with the linings of the tendons. The nerve is also within that, and so it's very common for the linings of those tendons to be thickened or redundant, causing pressure on the nerve. So that's something that I always look for when I do a carpal tunnel surgery, is how thickened that lining is and whether or not the lining needs to be removed. Very commonly it doesn't need to be removed. When it is removed, it usually gives the patient a lot of pain relief of their burning, tingling, and numbness as well. The reason that it's usually thickened is in patients with rheumatoid, diabetes, hypothyroidism, things like that. I tend to find those are the reasons it's thickened. The way that we treat carpal tunnel, conservative treatment is always the first line of treatment, so I usually put the patient in a night splint to keep their wrist from bending while they're asleep, so it just rests the splint nice and calmly like that. I like to try an injection of a steroid into the carpal tunnel as well, and that's not only diagnostic, but it's also therapeutic. So if someone suffers from, say, peripheral neuropathy, it's very good for me to be able to do a diagnostic injection of the carpal tunnel. Therefore, if that shot gives them any relief, I know that a surgery potentially could give them relief as well. Because as a surgeon, it's always hard to differentiate, is it the neuropathy or is it the carpal tunnel? So that's one of the things that I do to try and help distinguish that. Once the conservative things fail, such as splinting, night splinting, the injections, I also start patients on vitamin B6, which is a vitamin that's been shown to be good for nerve health. If they've failed all those conservative treatments, I usually get a nerve study test called an EMG. An EMG will show me whether the nerve is under significant pressure or not. A nerve is like an electrical cord in your house. If you cut the nerve in half, it's made up of multiple small little cords. That's exactly what the nerve in your hand is like. If the nerve is under a lot of pressure, the nerve study test will show me that. And that's very important because that will help also distinguish whether I think you need surgery or not.